Everybody. And as Mr. Nolan mentioned, and all of the other esteemed members here have mentioned, we're facing an uptick in cases. Myself and my colleagues see it on a daily basis in the hospital. I speak with a number of colleagues from around the country in infectious diseases. I also have relationships with hospitals in other states, and I get a sense of what's happening there, talking to them. I wanted to make just a few points. From my personal experience, when I've talked to patients, who are admitted to the hospital, and I ask them, what is it? I'm not going to judge you. This is your decision. Nobody's saying anything about your personality, character, anything like that. You made a decision not to get the vaccine. Tell me specifically so that I can learn what is stopping you from getting the vaccine. The most common answer is, I'm waiting to see if there are going to be side effects long-term, and the vaccine's been out for too short of a period of time, and it was developed really fast. In response to that, I will say that in the world of all vaccines combined, we've given about 3.5 billion doses, billion with a B, and of the Pfizer and Moderna vaccines, which we primarily use in the United States, at least 600 or 700 million doses have been given over the last 8 to 9 months. And if any major side effects were going to emerge, we would have seen them. I'll give you an example. About 2 million military personnel were given the vaccine in the US, and of them, 23 individuals developed this swelling of the heart, myocarditis. All of them recovered. Nobody had any long-term consequences. Similar examples are there. They are published in the best, most reputable, and most impactful journals in the practice of medicine out there in the world, not just in the United States, but in the world. The experience in other countries is similar. There is no problem with clots with our vaccines. Our vaccines are safe in pregnancy. Almost 4,000 pregnant women have been followed. Their outcomes of pregnancy in terms of the babies and the health of the babies, any malformation in the babies, any kind of genetic problems are similar to after vaccination to what they were before vaccination. So safety-wise, I think we have pretty good information. Now, when you talk about efficacy, does it work against the Delta variant? Does it work against other variants that are out there? 600,000 people in Israel were followed after vaccination. And once they calculated the vaccinated versus the unvaccinated people, how many cases occurred over the next 3 months, the vaccine was over 90% effective in preventing even getting the disease, let alone getting hospitalized or, unfortunately dying from the disease. It is very effective. And at that time, it was more so the Alpha variant in Israel. Subsequent information came from Qatar, a big study again. Then on the Delta, from England and Scotland, as well as from Israel, we have encouraging data for all kinds of vaccines. So the one that is used in Europe, the one that's used in India, and then the two that we use here, mostly Pfizer and Moderna. In all cases, about 85 to 90% from our vaccines, the ones that were developed by Pfizer and by Moderna, the two American companies that I'm very proud of, that the best vaccines have come from our country. These two vaccines, between 85 and 90% effective in preventing infection, and even higher in preventing, bad infection, preventing people getting into the hospital, people unfortunately dying. Yesterday or day before, I think I was rounding, and I calculated with our infection prevention people how many people are in the ICU who've had a vaccine. There were 21 patients in the ICU, 20 of them without a vaccine, one person with a vaccine who had received the vaccine, and that person had received only one dose. They hadn't finished the series, and they ended up in the intensive care unit. So what I'm trying to get at is the vast majority of individuals who are hospitalized are unvaccinated. And so in our hospital, and the experience that I've got from other colleagues around the country, infectious disease colleagues, leaders, as well as international colleagues, we are on something called the Emerging Infections Network, International colleagues are writing in and telling us the same thing, is that this is a pandemic now of the unvaccinated. Vaccinated people can get the infection, but they don't get very ill because the immune system is able to stop the virus. It's able to thwart the virus. And so after vaccination. So it is unfortunately now a pandemic of the unvaccinated. As I've mentioned to you, safety is reasonably well established. Relative to any other type of medical thing we do, it is reasonably well established. Within the time period that we've had, it's reasonably well established that they are relatively safe. I personally know at least 500 doctors who've got the vaccine, and everybody is working fine, no problems. It's been at least, my vaccine was about 7 months ago. 1 or 2 days of feeling poorly, but after that, totally fine. The funny thing is, I was seeing a patient, this was about 4 weeks ago or 6 weeks ago. Really unfortunate story, unvaccinated individual, waiting to see how it's going to play out. And when I went in to see her, she was on a lot of oxygen. And she tells me, I wish I had taken the vaccine. Tears in her eyes. And, I got a lump in my throat. I didn't want to tell her that it's possible that she may never leave the hospital. But there is this fear inside any doctor that goes in. You know that some of these folks are not going to make it out of the hospital. And you try your best to do everything to help them. But there is regret at that time. There are so many examples of that that I've seen of regret. To address the question of why was this vaccine developed so fast, let me reassure you that the technology, the mRNA technology behind Pfizer and Moderna vaccine has been known and in existence for 15 years now in the scientific community. The only reason it developed fast was because there was a sense of urgency in all of the pharma companies. And basically, they stopped all their other projects, just focused on one project. Operation Warp Speed that the last administration did basically gave $23 billion for vaccine development. They said, you take this money to the pharmaceutical companies. We don't care if you pay it back. Just get a good vaccine in. So that's why it was developed fast. The technology was on the shelf. The amount of urgency was incredible. And then the amount of money that the government rightly used for this purpose was adequate to allow that development. And now we're seeing the benefit of that. So please, before something catastrophic happens to someone you love or yourself, trust me and trust all the other doctors that are telling you this. We have no hidden agenda. We are on your side. We are here to take care of you. It is our privilege to take care of you. It is our duty and oath to take care of you. Every single one of us stands by you, and we would like you to consider vaccination quite seriously.